recording. Go ahead.
All right, thank you. I just want to thank everyone for joining us for our July 2017 PFAN Network call. This is our virtual meeting that takes place the second Wednesday of each month at noon Pacific Standard Time and 3 p.m. Eastern Standard Time. So I would like to thank all of you for joining us today. We're having an action-packed agenda, so I will not be before you long. I will briefly go over the updates in regards to the organization, and then I will pass the baton over to Courtney Roman, who will have an excellent presentation. She's from the National Partnership for Women and Families, so she's going to give us a dynamic presentation today. I'm trying to get... All right, there we go. All right, so we are Zooming. Just want to make sure for those of you who have never been a part of the Zooming platform before, by all means, this is very informal conversation on today. So you can either use the chat option that's at the bottom rhythm, at the bottom here, and you can chat there, or in between, you can share your thoughts or your feelings. We will definitely leave time for Q&A as well as conversation. If you would like to stop your video, by all means, you can do that as well. We do encourage everyone to mute their phones when they're not engaging in conversation, just because instead of putting us on hold, if you work for an organization, when you put us on hold, we can hear the background music that you have going on for your organization and all of the advertisements. So we would prefer that you mute us versus putting us on hold. Okay? All right. So we always want to start off by talking about what PFCC Partners represents. We recognize that the quality of healthcare outcomes is improved when the expertise of the healthcare provider is partnered with the experience of the patient and family. From the bedside to the boardroom, patient and family-centered care is about partnering to design policies, programs, and individual care plans for the best possible outcome. And as always, we have three buckets in which the PFAN network falls under, and that's the community, that's the skills exchange, and the engagement opportunities. So today on this call, we are engaging in skills exchange. You'll learn about what others are actually doing, and that's what Courtney is here to provide us with some skills exchange. We'll talk about what's going on in the community as well as some engagement opportunities. I have both some internal opportunities as well as some new external opportunities to share with you today. I would like to advise you that while you are listening to the engagement opportunities, we want you to be present and engaged on the call. So don't worry about if you don't capture all of the information. What's important is if you just give me a call or shoot me an email at erica@pfccpartners.com, and I can get you all of the logistics, all the information you need in regards to the engagement opportunities. I think that you all will be quite pleased to hear about the engagement opportunities that we are currently involved in. If you weren't on the call last month, I just want to share with those who weren't, we have just launched our new PFAN Network website. So please go out there. There are two websites now. There's the PFCC Partners website, and then there's the PFAN Network website. And that website is catered to the patient advisors. So we would love for you to go out on that website and give us your thoughts about possible improvements, suggestions, what should actually be on that website, because it's really about you and for you. I also wanted to mention the peer-to-peer support platform that we have with smart patients. Don't forget to go out there and have some conversation with your peers on that as well. The PFAN newsletter will be coming out on next Friday, so everything that we're talking about today will also be listed on that newsletter. We've already mentioned the virtual meeting. And if you have not already completed the interest survey, if I haven't personally spoken to you or you haven't completed the survey, please do so. That gives us an opportunity to see what you're passionate about, what you hold near and dear to your heart, where your priorities are. So when we have engagement opportunities, then we can match you with things that are appropriate for you. So let's get right to it. Does anybody have any questions before I go into the engagement opportunities? Okay. So our first engagement opportunity that we have, this is considered an internal engagement opportunity, and this stems once again from our summit work group on last year. It's the patient access work group, and they are currently partnering with Open Notes. And I just wanted to share that we had an excellent testimony from Tara, who's normally on these calls, but she couldn't be here with us today. She, during the last Open Notes, the last patient access work group call, there was a call to action, and all of the patient advisors were asked to go out and speak to a member of your senior leadership team and see if they in fact have Open Notes at your facility. At her facility in North Carolina, they do not currently have Open Notes. However, her CEO was interested in learning more about it and getting information regarding Open Notes. And for those of you who are like, what is Open Notes? It's pretty much a platform that enables and encourages patients and family members to know what the physicians or what the clinical staff are actually saying about their care. You're seeing your notes, you're seeing, diagnosis, prognosis, all the information, more than just your lab results. And people do not know that this is something that they should be entitled to, privileged to. And by having Open Notes, it changes the conversations that you in fact have with your clinicians, as well as, from the inpatient standpoint, as well as the outpatient standpoint. Lindsay, are you there with us?
Yep, I'm here.
Did you have any further input when it comes to the Open Notes, what they've been discussing on their call?
Nope, I think you hit it on the head there. I can say that if anyone wants to join any of the work group calls, to please let me know. They're happening monthly, all of the different ones, and I think the patient access one, it's the last Thursday of the month, or the third or fourth Thursday of the month at noon Pacific Standard Time. So if you are interested in joining, you can let me know, that one or any of the other work groups that we have.
And to Lindsay's point, even if you can't get on the patient access work group calls, even if you take that, that call to action and go back to your facility to see if Open Notes is at your facility, and you can come back to the virtual meeting next month and share if you in fact have Open Notes, or if a member of your senior leadership would like to know more about the program. Does anybody have any question about Open Notes? Okay, let's move to the next opportunity. So the next opportunity is our next work group, and that's the quantitative work group. And what they're currently working on is the discharge process. And we're looking for organizations to interview approximately 15 of their patients and or family members to find out what's important to them, what was actually needed before they were discharged, and in regards to the discharge process. There's no better way to find out what a patient needs or what a caregiver needs except by talking to them. So if you're at all interested in being a part of that work group, that meeting is actually going to be tomorrow, noon specific time, and the information is there. Like I stated before, you don't have to worry about jotting the information down. If you are in fact interested, just shoot me an email and I can provide you with that information as well.
And Erica, for the qualitative work group meeting that will be tomorrow, we are currently in the planning stages of developing this interview guide per se, so we can get that qualitative experience of the discharge process. And we're also working to set parameters for these interviews. So if you have any experience with interviewing or are interested in this, I would highly recommend joining us tomorrow. And yeah, all of the information for the meeting's right there. So thank you. Just want to add that.
Thank you. No, thank you. And our last and final internal summit work group is the PFAN network, and that's what we're on today. So recall that we initially had the work group that was building a national patient advisory council, and we realized that that's in fact what the PFAN network is. And on our last call, we discussed the fact that we were starting our new website and that we wanted to develop a mission statement as well as a vision statement for the site. And Libby, who is our CEO and founder, she is adamant about making sure that this is a co-design and that this is a partnership, not only with the members of our team, but with the actual patient advisors and those of you who are a part of this call today. So we are soliciting the feedback. I'm going to give you a moment to just review both the mission and vision statement that our team, what we developed collectively, but we want to hear from you if you have any thoughts here on the call. So I'll give you about 30 seconds to review each, and then we'll have a small dialogue about the mission and vision statement. Okay. Does anybody have any initial feedback, anything that completely popped out at you that you thought was either completely inappropriate or that you thought that's a must keep when it comes to either the mission or vision statement?
I think it looks good. This is Joan. I mean, the only thing that I initially thought was, should it, say anything about kind of improving the patient experience? But I think it's kind of understood in saying effective healthcare systems, processes, and policies.
And are you speaking of the mission statement, vision statement, or both of them, Joan?
I'm not sure. I guess I was looking at specifically the vision statement.
Okay.
But I don't really think it's necessary. I think it's kind of, underlying.
This is Stephen Hoy. Hi, Joan.
Hi.
Hey. The reason we ended up leaving out the patient experience specifically in these is because I think the patient experience falls under the care delivery itself, and narrowing into patient experience is a good way for this work to find its way into healthcare, right? A lot of patient and family engagement has been done under patient experience, but it isn't the overarching goal, right? I think in my mind, the overarching goal is to improve care delivery, and the patient experience will kind of come up in that. So that's kind of why we intentionally left out the patient experience and went with targeting the large mission and vision of improving the care delivery itself.
Yeah, I totally think that makes sense.
Awesome. And again, this is this is what we came up with, but we wanted the opportunity for the PFAN network itself to co-design its mission and vision as sort of a national entity of patient and family advisors of what we would like to accomplish. So just again, inviting others' feedback.
Okay, it's kind of quiet on the phone, even though we have 15 participants, and I do understand it takes me a while to think through it and do some wordsmithing. So I do encourage you to, when you get an opportunity, to look at both the mission and vision statement and provide your feedback. We want to make sure that this is in fact a co-design. So thank you so much for everyone who felt that we needed to have a separate mission and vision statement that was tailored to the PFAN network. Okay, so now we're going to switch gears and move over to our external engagement opportunities. And we are excited that this month we have 3 new opportunities to share with you all. So the first opportunity is one of the 100 Million Healthier Lives, and they have reached out to PFCC partners seeking out individuals who would like to be a part of 2 different work groups. One of the work groups, as you can see here, it has the Health and Wellbeing Matrix Development Group, and then they have the Health and Wellbeing Measurements Implementation Group. So if you're interested in either one of those, I have additional details about both of those work groups. Please do let me know, and I will share that information with you. They're looking for someone who can spend approximately 2, no more than 4 hours a month on their calls and being a part of the partnership. I haven't gotten all the information in regards to the honorariums or how much they pay for this event, but I'm waiting to get some more information about that. But if you're into the health and well-being, please do reach out to me and I can share some additional information about that particular external opportunity. Another one that we are really, really excited about is IHI, the IHI National Forum that's taking place at the end of this year. It's going to be December the 10th through 13th in Orlando, Florida. And there are actually 2 scholarship opportunities. So there's one scholarship, the deadline is sooner rather than later, and that's the Patient and Family Advisory Scholarship that it's due by July the 28th. And then there's the Jim Conway Scholarship that is due by September the 15th. No experience needed to be a part of either one of these. They are covering all the expenses if you decide that this is something that you may be actually interested in doing. This is a very rich conference with thousands of sessions. You learn just so much information if you decide that you want to be a part of this. So the information is listed at the bottom here, the link, but like I stated, just shoot me an email and I can definitely provide you with the applications. But I encourage you, if you can attend, if those dates are cleared on your calendar, I would definitely put in a scholarship. Now, everybody will not receive a scholarship. I don't know how many scholarships they'll be giving out this year, but I was able to attend a few years back when I was in the role of a patient advisor for my son, Ellison Speed, and it was remarkable in regards to what I learned about quality improvement and just being there with individuals who weren't necessarily my peers, but they wanted to hear from the patient and hear the patient's perception. So if you're interested, please do let us know. We're excited that these opportunities are made available to our patient advisors. Any questions? Okay. And then our last opportunity. Oh, I'm sorry, did somebody say something? And then here's our last opportunity, and we have Courtney Roman, who's actually on the call. She's going to talk about the National Partnership for Women and Families. And you're probably wondering, we already have the PFAN, and her organization is the Person and Family Engagement Network. And we will definitely be sharing at the end of her presentation the difference between our PFAN and her Person and Family Engagement Network. We feel as if these 2 organizations complement each other and that it makes sense to have this opportunity on the call today. So Courtney, are you ready?
Yes, thanks, Erica.
Okay, so I'm going to switch to the other presentation.
Sure.
And let me know if you see it.
Looks great.
Okay, are you able? All right, so just let me know when to go.
Okay, sounds good. We can start right here on this slide. So hi, everybody. It is really great to virtually meet you all. I wanted to start by thanking Erica for inviting me here today. Really appreciate that, and I'm glad to be able to talk with you all for a few minutes. So like Erica said, my name's Courtney Roman. I work in an organization called the National Partnership for Women and Families, and we are based in Washington, D.C. So I definitely want to leave time to answer questions at the end and make sure it's clear the difference between your network and this one. So I'll tell you a little bit about what I do want to cover today in the time we have together. So I'll give you a little bit of background on my organization. Then I'll tell you a little bit about CORE, which is the organization that we're partnering with on this project. And then I'll walk you through the details of our Person and Family Engagement Network and what that really means and it looks like to be a PFE partner. And then we'll definitely leave time for questions, and I'll have my contact info on the slide so you can get in touch with me if you want to talk further. So next slide. Thanks. So I'll start with some background on my organization. The National Partnership for Women and Families is a nonprofit advocacy organization. Like I said, we're in DC. We've been around for a little over 40 years. We work on a variety of important healthcare issues with a large focus on healthcare quality, the way healthcare is delivered, and patient and family partnerships. And when we say partnerships, it's very much aligned, it sounds, with what your organization feels as well, in that we mean ensuring patients, family caregivers, consumers, and advocates are equal partners at all levels of the healthcare process. And the team that I work on at the National Partnership specifically focuses on patient and family partnerships. And for several years, actually, our team worked with hospitals and primary care practices around the country to start and sustain patient and family advisory councils. But in the more recent year or so, we've shifted and to helping patients, family caregivers, and advocates to become an integral part of the quality measurement development process. That's really, I think, the key difference here that I want to talk more about as we flip through slides here. So next slide. Okay, so a little bit about CORE. CORE is the Centers for Outcomes Research and Evaluation. They are based at Yale University in New Haven, Connecticut. And our organizations, CORE and the National Partnership, are different in that we do advocacy and they are researchers and providers. And the researchers at CORE develop healthcare quality outcomes measures for adults in hospitals. So specifically, mostly for the Medicare population and some Medicaid. So what this means is that under contract with the Centers for Medicare and Medicaid Services, CMS, CORE researches, calculates, and writes certain measures that hospitals are held accountable for. So some of CORE's measures assess readmission rates, mortality rates, complication rates, and sometimes payment. So for example, CORE may develop a measure that assesses how many patients are readmitted to the hospital 30 days after having heart bypass surgery. So these measures are very important. They help us understand how well hospitals, doctors, and other healthcare professionals are performing and potentially what could be improved. And CORE is extremely well respected in their field in how they develop and test these measures. And historically, CORE always involved a number of different stakeholders in developing their measures, and that was good and important. But a few years ago, they realized that there was a big gap in their development process. And the gap was that they were never involving patients or families or advocates in their processes at all. And that was a real problem because patients and families are ultimately the people who are using these measures. So we give them huge kudos for coming to this realization and wanting to fix it as soon as they could. So they came to us because they didn't know really how best to partner with patients and families and advocates, and they wanted to do it right. So for the last few years, we've been helping to identify and prepare and support patients and families and advocates to partner with them on developing their quality measures. And they are very fully committed to this work and have really, it's been an incredibly great partnership since we started doing this. Okay, next slide. So for the last few years, we've been building and co-leading what we are calling the Person and Family Engagement Network with CORE. And we are really excited about this, the work, both the work that we're doing and about the really great people that we have been meeting who are now part of it and we've been supporting. So this is a nationwide network. So far it's made up of about 60 individuals, patients, family caregivers, and advocates. The participation is all virtual. All the opportunities to participate and all the activities are done either by conference call or online, just like this one. And it's really, this network is really a first of its kind group in the quality measurement arena. It's really the first time that patients and family caregivers and advocates are consistently looked to by a quality developer for guidance and recommendations. And we have been really, it's been really important to us that the network partners have the opportunity to shape and guide quality measures in their earliest stages, and the chance to continue to work with CORE to see this change through to the end. And they are really making a real difference in the way quality measures are created and ensuring that they make sense for patients and families. That's the real key. So next slide, I will show you here what it really means to be a patient and family, a person and family engagement network partner. So in terms of what to expect, first, network members sign up for 18-month terms. And the reason for this is because, as we all know, change in healthcare is really slow, unfortunately, and that includes developing quality measures. From start to finish, it can sometimes take years for a measure to be completely developed and vetted and tested. So we ask for network partners to participate for a term of this length in order to see change happening and to really see some of the fruits of their labor. Second, though, it's important to know that network partners are not asked to do work consistently over that time frame. Instead, they're asked to participate in 4 to 6 activities over the course of that time. And we make sure those activities are, first, aligned to a person's interests, their expertise, and the time that they have available. And second, that there are a combination of lighter and heavier lifts. So, for example, sometimes CORE is beginning to develop a new measure concept. So we'll pull together a working group of patients and families, and they may meet several times over maybe a 6-course period to dig into that concept and consider what may be feasible, what's most important, that kind of thing. So that would be a heavier lift. But on the lighter side, CORE will also periodically send out virtual surveys about a topic, or they'll maybe want to do a couple individual conversations with some network partners about a topic to get a better understanding and dive a little deeper. So those are kind of lighter lifts that are also available. Just to give you a sense of some of the topics and what we've been discussing over the last year, we've had activities around measures focused on cardiac issues, diabetes and hypoglycemia, harm in hospitals, socioeconomic status and its impact on measures, hospital-wide mortality has been another one. So those are a few examples. So another key item to know is that the National Partnership provides support to all network partners throughout their terms. We ensure that everyone has what they really need to participate effectively. So we will do prep and debrief calls before and after working group meetings. We'll provide prep materials. We'll answer questions or concerns. We want to make sure that this is a meaningful and positive experience for everyone. That's really, really important to us, and we're the go-to for making sure that that happens. So finally, at the conclusion of a term, Network partners receive a $250 honorarium, which is just a small token of appreciation for their participation. Okay, next slide. So I wanted to make sure that you had my contact information here. I'm happy to answer any questions about my organization, the network, or what it means to be a network partner. I can also share, at the conclusion of this call, I can circulate with, to Erica, a couple of background documents that'll further explain some of this just as a reference. But if this is of interest to any of you working with us potentially, I would love to hear from you, and you're welcome to email me or Erica if she's willing to pass that information along to me. And we would, I would set up a conversation with you, and we would talk further about some of the details and make sure this would be a really good fit for you. So I want to stop there. I'm happy to take questions, and thank you all so much for your time.
Thank you.
So we're going to open up the floor
I'm
for anybody who
Hi,
has Courtney.
this is Joan.
Hi, Joan.
Hi, I was just curious if you could maybe just give us a little bit of an example of one of the topics that you've worked on, and how the patient can assist, just to give us a little bit of sense of what the work is like.
Sure. I can give you a little bit more of a flavor. I'll give you one of my favorite examples that's happening right now as we speak. CORE wanted to develop, I can't believe this doesn't exist, but it doesn't, a measure for diabetes and hypoglycemia. So looking at hypoglycemia rates for folks who present in the hospital, in the emergency room. And they really wanted to create a measure that made sense to patients and families. So this was one that was dear to my heart. My mother has been a type 1 diabetic for over 20 years. So this one was pretty neat to me. And so we we worked on recruiting and supporting a group of patients who have type 1 and type 2 diabetes. And also a few family caregivers. So they have a parent or a spouse, in this case, with diabetes, type 1 or type 2. And they've been meeting over the course of several months. By the end of this month, they will have had 5 meetings. And they are really helping to shape this measure. And it's been a really rich discussion. And the interesting thing that has happened, there's been a bit of a plot twist, if you will, as they've been meeting. The measure was originally planned to be designed through claims data, of course, you know, that hospitals were collecting and that CORE was going to analyze. But because of all of the feedback that they've heard from the patients and families about hypoglycemic events and how so many hypoglycemic events happen outside of the doctor's office or the hospital, and so much of that, you know, can't be, just isn't in claims data. They're actually thinking about making the measure a patient-reported outcomes measure. So that would mean it would be designed based on patients and families' actual feedback and their experience versus claims data, which is extremely helpful but flat. So we're really excited by this. It's actually an extremely interesting development that they're going that way. We don't know how it'll turn out. You know, they have to get it through CMS, but they are actually meeting in 2 days to talk through that potential change. So we're really excited. And that has been, the reason I'm sharing this is that change has been 100% shaped by the patients and families on that group. CORE wasn't thinking about going in that angle when they started, but it's been due to the feedback that they've gotten and the stories that these folks have shared. And it's been a really interesting and very rich conversation from start to finish. These folks are personality plus. We almost always run out of time. So, you know, we always work on finding a very diverse group who's very interested in these topics. So I'll stop there. Did that help, Joan?
Yeah, that's totally an inspiring example. Thank you for sharing it.
Absolutely. Are there other questions? I'm happy to talk through anything as long as our fearless leader Erica tells me there's time.
Oh no, keep going. So there was a question on the chat room.
Oh, okay.
Anna Marie. Thanks, Anna Marie, for getting on the call. Yay. She said that with the data you are collecting about diabetes, what is going to be done with the data?
Okay, so right. So this is where CORE comes in. So they would collect data from hospitals about patients who present with a hypoglycemic event, so low blood sugar, and they would then use that data to design a measure for hospitals to be held accountable for. So how many patients, you know, have hypoglycemic events, and they would be tying it to quality of care. So is there a way to determine, you know, if you're having a hypoglycemic event in the hospital, is there something that, you know, your endocrinologist could have done to help you for that to not happen? Is there something that the hospital could have done? You know, if you were in the hospital for something else and you have a hypoglycemic event, yikes, that gets reported. Is there something the hospital could have done to help that be avoided? It speaks, hypoglycemic events in their mind speak to quality of care. So by designing the measure, they're trying to really capture that essence of quality and how it can be improved going forward. Sure.
Do you have other upcoming topics or that you guys are planning for the future, that you're planning ahead for new groups?
Sure. So that's a great question. And quality measurement is very interesting in that some things are known well in advance. So CORE's measures every year come up for reevaluation, if you can believe it. So every year they're kind of assessing, does this one still make sense? Do we need to tweak this a little bit? Do we need some input on this one, or is this tried and true and we're gonna keep it as is? So some measures are existing and you know, they know they're coming up. Some of them though come up very rapidly, and so we don't necessarily know in advance, and our network members have been very gracious with us, coming to them very quickly and saying, oh my goodness, we have this topic, is anyone interested, kind of at the last minute. But we are really on the cusp here through the end of our contract, which is through the end of September, so through the summer, of getting quite a few opportunities for folks to weigh in on. There are going to be some new opportunities around, which is really interesting, the MIPS and MACRA topic. So in this case, it would be thinking about measures that would, normally CORE historically has done hospital measures like I've been talking about, but coming up here very soon, they're going to be looking at them from the physician level, which is really interesting, which will be more around holding physicians accountable for patients' outcomes, which will be a really interesting new angle. So we have some of that coming up. We're also exploring some opportunities with measures that are coming up for public comment. So I don't know if folks are very aware of the fact that a lot of measures come up for public comment, which means they can be reviewed and anyone in the general public can review them online and talk about them and say how they, what their reactions are to the measures. And this is a new thing that we're starting for the summer, where we are helping network members to comment on some of these really important measures. Unfortunately, the CMS database is a little bit clunky, so some of the support we provide is logistical, but we also have been helping folks to kind of dive into some of these measures and understand them a little bit better, and have them submit comments, because again, not surprisingly, often the patient and family voice is left out of these public comment periods. It's not well known outside of kind of the government advocacy world that this is always an opportunity available. And so we've been helping some of our network members, and they've really enjoyed being able to weigh in that way. So we have that coming up as well.
Are there plans to market it or to get it known to a broader population, or?
Yeah, that's a really good question too. And we've been talking through that a little bit with CORE, and how to best do that, and message it to the public. CMS tries now, but it is, again, not surprisingly, super wonky, and hard to really even dig in and understand what the ask is. So we've been trying to help them sort of figure that out a little bit more. And in general, with some of the ways that CORE talks about their measures, and CMS as well, some of our network members are very well versed in health literacy and have backgrounds in education and communication, and we actually are planning to start a little group to talk through, just in general, how to better message to patients and families and the general public about quality measures, and public comment, and that type of work to know that those opportunities are available, and to be interested in weighing in.
So just in case others are still thinking of questions, I just wanted to, I know we have some new members on the call, and they aren't patient advisors or care providers. You are more in the role of a facilitator at your organization, but by all means, by getting on these calls, you're able to take these opportunities to your patient advisory councils and share them with them and get them engaged. If if the logistics is hard for them to be on the call in midday on a Wednesday, but just know that we would like for your input as well on these calls. Okay, any other questions for Courtney?
Courtney, in terms of kind of soliciting other people, is there like anything special that you're looking for, like someone who had heart issues or something like that? That's my first question. And my second question is there the timing issue in terms of when you want to kind of get people on board?
Okay, those are great questions. Thank you. I'll do the second one first. There's no timing. Being part of the network is rolling. What the process is normally, if someone's interested and I hear about them through email or someone connects us, I'll set up a time for us to talk that's convenient for them and give them more details, and we'll start the process that way. There's no timing, no real timing. And also, we know that the folks we're working with have very busy lives, and often health conditions that they're taking care of. So we are very flexible in when people can work with us, or if they want to or not. We want it to be very aligned to their interests. One example is we work with this gentleman in Michigan who is wonderful, but he is a farmer, And in the summer, he is very busy, and he tells us without any hesitation that he goes dark with us in the summer. And that is okay with us, and we pick it back up with him in the fall. So all of the, we can be very flexible, just so you know. And in terms of who we're looking for, there's no real criteria. We are looking for working with patients, family caregivers, or advocates, and they can be from anywhere in the country. Again, we'll work with them on schedules, and they don't need to have any kind of background in quality measurement at all. In fact, we love it if they don't, because you come from a very very pure perspective, and again, we offer that support. So there's no necessary traits. It's all about just their experience, and we are open to any and all, as long as they are a patient, family caregiver, or advocate.
Great, thank you so much.
Sure.
Well, on behalf of PFCC Partners and the PFAN, we welcome this opportunity. We embrace it. We're really excited about Courtney coming on the call today. Once again, her organization is really heavy into quality improvement and quality matrices and measurement. And when you think about the PFAN network, like when you say, well, what's the difference? When you think about the PFAN network, remember that we're all about building the skill set and to help provide opportunities so you can be utilized across the continuum of care. So we're more, on the ground at the local level with you, how you can make changes within your organization. We provide you with opportunities abroad or, outside of that brick and mortar of your organization. Courtney's just taking it to the next level when it comes to the overall research component of it. So we embrace it. If you are indeed interested in this opportunity, just CC me on it when you're communicating with Courtney. We don't get any, gain from it when it comes to monetary gain, but we do like to know that somebody from the network was actually referred from our organization, so that we can just keep tab on that and just say that we were able to provide an opportunity outside of the California area or outside of the brick and mortar of your actual organization. That's in a nutshell what PFCC Partners that's the involvement that we would like to have. And I just want to apologize. I forgot to mention one of the opportunities earlier. I pulled up one PowerPoint and I had two versions of my PowerPoint from earlier. So I just wanted to go back and state that IPFCC, which is also in Washington, D.C., CEO Bev Johnson, she sent the opportunity from the University of Toronto. There's a 2-minute survey that they're asking people to go out and take. And the question that they want to know is, what are the world's 10 most important unanswered research questions in primary care? So if you're actually interested in that, please do let me know. And like I stated before, it will be on our newsletter. And if you send me an email, I can share it with you. But I'm so sorry I forgot to include that earlier on this particular slide deck. Are there any other questions? Any other dialogue? Anybody's got something they've been working on since the last time we connected last month? Some exciting news from your area? Joan, you're smiling. You have something to say.
No.
Nope. Okay.
I'm good.
Okay. Jennifer, do you
Hi, I just wanted to check in and say this is Kathy Smith, and I'm from Thunder Bay, Ontario, Canada, and it was very nice for Courtney to mention that study out of the University of Toronto, and I've thoroughly enjoyed listening today. I'm a little on the quiet side, but that won't always be. Thank you.
Thank you for joining us. Thank you. I was hoping you would be able to connect on the call today.
Yes, I'm here.
Yay, okay.
This is Jennifer Dirksen. It's Jennifer Dirksen, and I work with Loma Linda University Children's Hospital. And last night at our Family Advisory Council meeting, we had the head of the dietitians and food services come, and we were able to get her informed that parents are wanting meal cards so that they don't have to leave their child's bedside. And I wondered if anybody has that at their institutions already.
Can you say that one more time, like elaborate what you mean by that program?
Sure. What it is, I know at UCLA, parents are able to use a meal card, and when their child orders a meal, they can order a meal for themselves, so they don't have to leave their child's bedside to go down to the cafeteria to get a meal, that it will arrive with their child's meal, and they obviously have to pay for it out of pocket, but it's delivered to them instead of them having to go and get it. Because my personal experience, my son had bone cancer, and so there were days where he just was too weak and he wasn't able to walk. So if he needed to use the restroom, obviously he needed to go right then. Couldn't wait for nursing staff to come assist him. So we always had somebody with him 24/7. So just easing that parent burden when their child's in the hospital, especially for long periods of time. Help?
Jennifer, this is Lisa Marie. My daughter was a patient for a number of years at Primary Children's Medical Center, and I worked with their PFAC for a number of years. They have on-demand ordering for food, so they don't have a set time that they deliver food. Patients order, or a dietitian orders off a menu, and if they're, for example, if they're liquids only, then there's a liquids only menu for that patient. And they allow parents to also order. And as you suggest, they have to pay. I'm not sure they're still doing that, but they were doing that. And of course, the parents all loved it. But importantly for the hospital, they found out that when patients could order from a number of options on the menu, that their intake went up, waste went way down, and everybody benefited. It was, as you suggest, important for many of the caregivers to not have to leave the room to go get food, because it was so hard to find somebody to sit with their child. So you might consider contacting Primary Children's as a kind of to find out what their practice has been and how that has continued to work for them.
Thank you. Where is that located? Where I've not heard of Primary Children's.
Right. It's Primary Children's Hospital in Salt Lake City, Utah.
Thank you.
Jennifer, at John Muir Hospital on our Patient Family Advisory Committee, there's a woman who spent quite a bit of time in the neonatal, and I know this isn't quite the same, but we're about to test using refrigerators in the rooms so that families can kind of bring in food and have access to food. So I don't think it's happened yet, but it's about to happen. And if you wanted to check back with me in a few months, you know, I might have some feedback, but that could be another option.
Yeah, there is a family refrigerator where parents are allowed to leave food for themselves, and they just have to tag it with the room number. But it's not a very large refrigerator. And in fact, yesterday when I was up on the HEMOC unit before my meeting, that topic came up, and it's come up again. And Loma Linda is in the process of building a children's hospital, so I know that that's probably in the plans. And that is an ask from the parents for personal refrigerators for each room. But yes, it's good to know that other hospitals are already doing that. because there's some resistance, especially from the facilities end of who's going to maintain and clean that refrigerator.
Right.
So, and who's going to pay for that many refrigerators?
Yeah, those issues did come up, but they worked through it all, and we are about to do it. So, yeah, check back with me, and I can let you know.
Yeah, thank you.
Sure.
And Jennifer, this is Erica again. If you, I need to switch to PowerPoint. If you send me an email, I can definitely, why isn't this frozen? I can definitely, where I used to work at AU Health, they have that similar program where you're able to get meals, the loved one's able to get meals without leaving the room, and that's both on the pediatric side as well as on the adult side of the hospital. And I'll see the functionality of that program and see if they can provide me with either like a policy or what their SOP is that's currently in place. So just shoot me an email, and that'll give me a reminder to reach out to my former peers.
Thank you. Now, the email for this call, did that come from you, Erica?
Yes, yeah, Erica
Okay.
at PFANetwork. Mm-hmm.
Okay, thank you.
You're welcome. Does anybody else have? We have 4 minutes left. Want to be respectful of your time. Is there anybody else on the call who had something they wanted to ask?
This is Kathy Smith again from Canada, but I'm just zeroing in on that conversation about having the patient's family being able to have meals in the rooms. My experience was with Lee Southwestern in Florida, in Naples, Florida. It was a neurology adult wing, and all that needed to be was when the patient was admitted, they had a pre-approved amount on their visa, and that would be for incidentals of any kind, television or whatever. And when the caregiver or the partner would order a meal to be delivered to the room, it was just deducted from that pre-approved amount. It worked very smoothly, and it was a real godsend when people are in intensive care.
Thanks for sharing that. All right. Well, once again, on behalf of PFCC Partners and the PFAN Network, I want to thank all of you for joining us on our virtual meeting call today. We hope that you are able to join us next month. We looking for another action-packed agenda, and hopefully next month we can just have more of a conversation, and you all can share some of some of the strengths, some of the weaknesses, some of the opportunities when it comes to being a patient advisor, and how we can actually help you with whatever works that you're currently in. I will say once again that next week the newsletter will be going out, and it will have all the information from this call. We'll also provide the recording from this call just in case you might have missed something, you missed somebody who stated something on the call. The recording will be made available as well. I thank you all so much for your time. I thank you because you do not have to give your time. You do not have to volunteer in such a manner in which you do. So you all have a safe weekend, and I will talk to you all very soon. Thank you.
Thank you, Erica.
Thank you.
Thank you.
Bye.
Bye-bye.
Bye-bye.